By way of introduction, my name is Jim Greenblatt. I'm child and adult psychiatrist and a medical director and founder of Psychiatry Defined. But over this past year, it just became clear to me that as therapists at the front lines of mental health, mental illness, really need to understand the fundamentals of integrative and functional medicine. This is the world that we're all in the midst of. 40% of US adults in the end of 2020 reported struggling with mental health or substance abuse issues, anxiety, depression, trauma, substance abuse, consideration of suicide. Hence, our side effect profile is frightening. I mentioned stopping antidepressants. Antidepressant withdrawal syndrome is completely ignored by my medical and psychiatric colleagues. It's gotten to the point where some academic colleagues are recommending that antidepressants should be taken for life because depression is a chronic illness, and then you'll never have to worry about withdrawal syndrome. Withdrawal syndrome is debilitating, and a functional integrative approach can completely eliminate withdrawal. And they're really important because these essential amino acids make all the proteins in your body, all the enzymes in your body. And for our purposes, they also make all the neurotransmitters, not all, most. So in the depression book that we wrote a couple years ago, I used the zebra mnemonic as a way of helping patients and clinicians understand how do you assess this individuality. And when we're under stress, magnesium leaves our body. So as cortisol levels go up, now this could be from a job interview to being in traffic to raising kids to being at home in a pandemic, stress, be it mild, moderate, or severe, affects magnesium, and magnesium is depleted from the body. It's pretty well organized and simple to understand. For our purposes, magnesium is critical to many aspects of serotonin, the neurotransmitter, synthesis and release. So the foundation of modern psychiatry is neurotransmission. You've heard of serotonin and dopamine, norepinephrine. There are hundreds. There's actually literally hundreds of chemicals in the brain that function as neurotransmitters. And we've never really proven a serotonin deficiency syndrome, but I think it's pretty safe to say, based on both functional medicine and traditional psychiatry understanding, that there is clearly a dysfunction of how neurotransmitters are functioning in our patients that are struggling.